Okay. Frank Pinchero calling to meeting, order of Melrose Board of Health emergency meeting, August 11th at 7:07. Present Frank Pinchero, Carol Ann LaCitra, Maureen Garapay. Board members.
Okay. I believe we also have on here tonight, Steve Mayo, Town Administrator for the town of Wakefield. EC, I believe we have our two clerks. And we also have Mark Sardella is here, Melissa Lowry, our new public health nurse, Stephen Ingalls, Mr. Tom Walsh from Emergency Management, Mike Carrigy, and I believe Christine Kresser. And where is, I thought I saw, no, I didn't. I thought I saw somebody else there, but I guess not. Okay, so since you've called this meeting to order now, according to the agenda, this meeting was called for some updates in regards to the COVID situation. I thank you for taking the time to be here tonight. This meeting was to update both of the boards on the COVID cases in your communities. We have seen a rise in the cases the last few weeks. Numbers are varying by 1 to 6 cases a day. They're mostly breakthrough cases. Those are the cases of those that are fully vaccinated. We have no hospitalizations or deaths that we are aware of. These are people who have traveled, have no knowledge of exposure, and most are experiencing either no symptoms at all or mild cold symptoms. Our cases are varying in age groups, and the child cases have increased. At this time, Mayor Broder of Melrose has met with the health department, and he will be implementing that a mask will be worn in all municipal buildings at this time, starting on August 16th, 2021. Mr. Mayo?
Oh, thank you. Again, thank you for the board members for coming tonight. And I do want to thank the board members and the health department for all the work you've done through this. I think all of us hope we wouldn't have to be talking again, yet we're still going at 100 miles an hour. And I know that I talk at least daily with Cindy, who does a great job in the Wakefield office, almost daily with Elaine as well. And Elaine, thank you for taking this on. While to come, and Tom Walsh, our emergency management director, who he and I meet every day on this. Do you want to talk a little bit about the numbers over the last couple of months, month and a half, because I do try to look at the science on this thing. And you know, since August 1st, since July 1st through today, Wakefield has experienced 55 cases, which is, you know, a little bit over 1 case a day, which is not anything to be overly alarmed at. And as Elaine did say, that all breakthrough or mostly breakthrough cases and no hospitalizations, and thank God, no deaths. You know, working together over the last, year and a half now, we've made a lot of changes in Wakefield. We have created a lot of physical changes in our town hall. There are, I think, virtually every department is protected by glass or plexiglass. We have greeters at the front desk that check everybody in. Most of our employees are vaccinated, and our policy has been for a very long time now that if you are not vaccinated, whether you're an employee or not, and we have a pretty robust list of our employees about who is vaccinated, but if you are not vaccinated, you need to wear a mask when you're in the building, whether you're a member of the public or a member of our staff. And our people have been very good. Some of them are reminded, but they've been very good about adhering to that. Also, a lot of how we do business in town, a lot of drop-offs, a lot more email, a lot more portals, electronic. So there's very little not that many walk-ins anymore in town hall, which is a little bit lonely, but it's the way of the future, I guess. Our work staff is pretty well spread out and cubed and protected as well. We have asked those that are going to the senior center already, particularly those that are playing bridge or bingo and are that a little bit closer quarters, that they do mask. And anybody who knows our senior center director, I would say a request from her is much more like a mandate. Going very well over there. And we've really spread out our classes that maybe are a little bit more moving around there. So at this point, I think we're watching the science. We certainly recommend to people, if you're more comfortable, wear a mask. Anecdotally, we've seen more and more people coming in masks, probably because they feel more comfortable. A few staff members doing it. I think I would like to say we should recommend and follow the CDC guidance and maybe recommend people to do that. I'm not at this time in favor of a mandate myself, and I'm speaking for myself only. My board has not taken this up. I know my emergency management director, Tom Walsh, is here. I think I hired him to work part-time a few years ago. That didn't work out too well either, but maybe Elaine, if it's okay, maybe he can just add a few things.
He sure can. Go ahead, Tom. Thank you.
Thank you.
Hi, hello, everyone. My thing is I just try to use a common sense approach to how we go about it. When I look at the cases and which you said they were caused by people who have already been vaccinated, they haven't been ill. But the things that I want to stress is if they didn't get it in a public building, if they weren't a public employee, I'm not sure why we would then mask our public employees or ask the public to come into our public buildings and get masked if it wasn't a reason. My job has been to identify problems and then get them mitigated. However, we can get that resolved. But in my own thing, I just don't see a reason for Wakefield to do it because none of the issues have been caused by either our public employees or our buildings. So that I would go along with Steve at the same thing.
Thank you, Mr. Walsh.
Elaine, may I?
You sure can.
Hi,
Laurel?
Laurel Gorville, Board of Health. I want to take a mile high picture of this, or a space shot. We know what's coming. So, the science here is that we've been seeing clusters. Now we're really lucky that, Wakefield and the towns around us have a more reasonable vaccination rate. I have to say, if we don't go toward a mandate, I do want our signage to change. As I went into town hall the other day, it was, I think that we learned as a public health policy that vax or mask didn't really work very well because people were like, oh, masks are off, and they didn't really listen to the entire scenario. And that's why a lot of the country is where they're at. I think a different kind of signage that, either masks are worn by the public. I can tell you that in health care facilities, everyone's masking. If two colleagues who are known to be vaccinated are more than 6 feet apart, they can have a break in masks. But the mitigation model is really well described in something that the American Camp Association put together so that kids could successfully get through a camp season, which they've been able to for the most part. And that's kind of the Swiss cheese model of public health, which is every mitigation step that we can have has a flaw, and that's the hole in your Swiss cheese. And so, people are gonna drop their mask or not wear it for a little while. So that's the hole in that slice of Swiss cheese. But if people try, for the most part, to be wearing masks, that kind of beefs up that level of defense. Vaccination, of course, hand sanitation, distancing, good air movement. we're seeing trends across the world that are pretty frightening. And I'm not really a proponent of reacting to a situation after the fact. I think that we need to be mindful of this. If we don't mandate, at the very least, I would just get rid of the, if you're vaccinated, you don't have to wear a mask sign. And just say, you know, kindly wear a mask. That's one thing. This also harkens back to universal precautions. This is something that we came up with in the HIV days in the 80s, because people were tripping over each other trying to figure out who you respond with a precaution and who you don't. And we realized you're wasting way too much energy, and people are breaking through that, and you treat everybody the same. So therefore, everyone has universal precautions. Everybody wears a mask, or everybody gloves, everybody hand sanitizes. And that's kind of that's, you know, we're here to reflect the standard of healthcare, and then how that works in the public domain. So I just want to put that out there.
Thank you, Laura. Candace, do you have anything to add for Wakefield?
You know, I can hear the hesitation on a mandate. And I know I kind of want to like shrug my shoulders and hang my head, because I can tell that both towns have done so much work to get us to where we are. I don't know. You know, when I think about possibly strongly suggesting that masks be worn more frequently, I don't know if it's the biggest ask. You know, I feel like this is something that we've all been already set up for. And it may just be sort of like putting those, I don't know, putting those strategies back into place. You know, like we've already been shopping with masks on. We've already been in buildings with masks on. It's not new. It's not different. It was really nice to come away from it. But as we enter the cooler season, I don't know. I wonder if more discussion is needed about masking more in inside buildings, especially buildings that the public go in and out of, and especially buildings where more people could congregate. Like maybe that does mean a building, or maybe that even means you know, restaurants.
Thank you. The Melrose Board, do you have anything to say? Any comments or nothing?
I actually just got off a Zoom meeting with two of the infectious disease specialists at Tufts Medical Center, and they basically recommended that, yeah, we should follow the CDC's advisory or recommendation that masks be worn indoors in any place where cases are rising. And that pretty much means all of Massachusetts except for one county, Hampshire, I think. So I think that's the guideline we have to follow. You know, it becomes a little bit of a sticking point, I guess, whether it's an advisory or a recommendation or a mandate or a requirement. You know, if it's the right thing to do, everyone should do it. But unfortunately, people don't do it because it's the right thing to do. They kind of have to be forced to do it, unfortunately. So if it is the right thing to do from, you know, a scientific standpoint, we're seeing cases going up again. And I do worry about what's going to happen in the fall when it gets colder and kids are going to school and people are indoors more. And so unfortunately, if something is the right thing to do ethically, scientifically, it kind of has to be mandated, or you're not going to get enough people to do it. And while we're on the subject, they also recommended that schools should be in person with masks on. A little bit off topic, but so just to say, I mean, you know, again, talking to the infectious disease experts locally who are following this stuff 24/7, they're also quite worried about the direction things are going and taking a very aggressive approach.
Any other, the board from Melrose?
Yeah, I agree that there's definitely more conversation needed about this. I would almost say that probably everybody could have guessed that this was going to be happening as we got closer to the fall. And I agree that probably, just suggesting that people do it, I think that would be the best way to go, but I'm not sure that that will, enforce it enough that people will adhere. So I think we do need to talk more about it and be really on top of it over the next few weeks.
Maureen?
I think it's inevitable that we're coming to it, to mandating it at some point. Now, whether we decide to recommend it or mandate it, maybe we do need to talk a little more about it, but I do think the inevitability is there. But as far as Melrose is concerned, has the mayor already made the decision that, is that what you
Yes.
said?
Yes,
Yeah.
this is what he wished us to convey. He spoke to us about putting this, implementing the mask in all the municipal buildings. We have seen our cases go up. I know that Melissa Lowry, our public health nurse, is on. When we first saw them go up in the beginning of July, definitely was over from the 4th of July. Unfortunately, many people were inside. But just to give you, we normally report on a 2-week status. And when we just did for this week, from August 5th to August 11th, the town of Wakefield had 14 cases. And in Melrose, from August 5th to August 14th, we had 29.
And these
So-
are all breakthrough cases?
There were, Melissa, am I correct? There was probably a couple that weren't vaccinated.
Yes,
Children.
I would say probably a quarter of the people were not vaccinated. And those are the people you see that are very resistant to even talk to us. But the other people were vaccinated, that could be vaccinated, were vaccinated. Their children obviously were not, those with kids under 12.
Did we have many children? Were there many children?
We had a number of children and exposures in the camps. I ended up having to ask a camp to put a whole cohort of almost 30 kids in quarantine.
Mm.
So, so Elaine,
There were 2 camps that had more than one exposure, one in Wakefield and one in Melrose. And they were camps of significant size, 80 to 100 kids.
Were they masking, Melissa?
They are masking indoors, but they can play outdoors unmasked, but they're still supposed to keep their social distance. But that's hard for little kids, obviously.
Yeah, I mean, this is the thing. And as Candace said, it's not a big ask. I know it's a pain in the neck. I know we're all tired of this. I know we want to see people's faces. And, occasional break in protocol, but, a standard set high that everyone stick to this, it is going to mitigate some problem, down the line is our hope. I had the experience of managing COVID testing for 2 overnight camps. And same thing, Melissa, if one kid, kids were, there was a high testing burden. And, that's another part of the strategy and the whole Swiss cheese thing is just, kind of knowing what you're working with. But it's a really simple ask. It's, it's basic, it's becoming basic hygiene. And I know that we have gotten kind of polarized around it, but bottom line, we're here to review the science and the easiest things that we can do. This is how public health started. Basic sanitation makes a huge difference. And I do believe that, municipal buildings are really accountable to set the standard. And if we can't set the standard in a municipal building, then we could be in trouble. And you know what? If it's an overshoot, I'd rather overshoot than undershoot. The risk is pretty high. You know, I have a loved one in a nursing home where I occasionally get locked out because somebody came in with an exposure and they have to wait and test everybody. So that's still our reality. I would really like to see those instances diminished with a small effort of wearing a mask.
Elaine, can you share
Mhm.
what our other neighboring towns are doing as far as, besides Melrose? Do you know
Pardon me,
about,
please.
do you know about Malden, what our neighbors are doing as far as their protocols?
Everybody is doing, it's the craziest of things. Right now, Malden doesn't have anything. Tewksbury, a lot of the local places are doing their senior centers. We fortunately in Wakefield, they are masking up. And in Melrose, presently, our senior center is closed. So we don't have any senior programs going on. Belmont and Salem have both gone completely with mask. Salem mostly, I believe, is, you have to remember, they have a college community coming back in another week or two, and then they have their big Halloween. So they're going to have their mask mandates starting in 2 weeks, and that's going to last until after Halloween. A lot are just doing municipal, their municipal buildings. Some are doing just their municipal employees. It's kind of coming. Everyone is getting the new numbers. The numbers are going up every single day. Another thing that's going on, unfortunately, is that the CTC that took the cases from these cities and towns has winded down.
Oh, no.
They don't have the staff. They are now refusing cases. So we can't even send them cases at this time. They're extending their contract with the state, hopefully to have it signed to last until December 31st. But unfortunately, it's the burden of doing contact tracing is coming right back to the health department. We in Wakefield will be taking back, we had a person last year that worked full-time for us. She will be coming back next week on an as-need basis. We have the funding for her. In Melrose right now, Melissa is working constantly, and I am also. Both of us have been doing contact tracing this past week. We hope to have some funding. The mayor's office is helping us in Melrose to get some funding and see if we can get somebody back to help us. Unfortunately, these cases, and the testing is up, just to let you know. Melrose did have the Vax van at the recent summer festival. We don't have the numbers, but there was a good amount of people who went there. They're coming back in another week for the second shot, and they will also take people, I believe, for the first shot. Another thing that is really taking up a lot of our time and is people looking for their vaccination records. They have lost them. We have to go into the information. There's only limited number of us that have access to that. Some are not in there. We did receive an email yesterday. The Mass Association of Public Health Nurses has put together an email with the information for people to try to get their vaccine records. These are ones who have had them at the Doubletree, Foxborough, and that, because Prep Mod is now going out. That was the registration system that we used. And we have a new system, which we all are presently being trained for, called Color. And we're going to use that from the flu season on. So we have a lot of changes that are happening. And just with these cases coming up, and just now with the CTC not being able to help these, a lot of health departments don't have the access. Melrose school nurses pitch in as well as the Wakefield school nurses try to help us as much as possible. So now it's just trying to set up that back to help us to take the caseload. And you have to remember too, these cases are getting, like, if you remember the end, I'm sure that Maureen and Laurel do remember from contact tracing, you're getting parents who are vaccinated, who have a child, the child can come down with it, the parent gets it, or the parent gets it and gives it to the child. So when you're doing a case, you're doing a case on an investigation of a whole family, which could be 6 or 7 people, and that takes a good hour to an hour and a half.
Are we back to quarantining people, Elaine? Like back to 10-day quarantine?
Yeah, if you have been fully vaccinated and you test negative and have no symptoms, you do not have to isolate. You can go about your daily business. If you are fully vaccinated and you test positive, you are considered a case. So you have to stay in. Your isolation is for 10 days and recommended to monitor for 14 days. And depending on the vaccination status of those in the home, it will depend on whether or not they would be quarantined, and they would be in at least for 10 days if they were quarantined. And they also have to monitor for 14 days straight. We have a lot of people who, unfortunately, and I think Melissa can attest to this, that they're traveling. There's a case that came up, and in particular, people that went out of state. They had a history of COVID, came back, tested negative, waited 3 more days, tested again, were negative. Then 3 or 4 more days later, one family member didn't feel well, decided to go and get retested. This was for the 3rd time. It was inconclusive, still didn't feel good, went back the next day, and it's positive. Some people develop a symptom on Sunday. It's a mild cold symptom. You know how it is. You figure you just have that summer cold or it's allergies, and it doesn't go away by Friday. So they go on Friday to be tested. And then on Friday, they're positive. And more than likely, they were symptomatic that first day. So they're contagious, and we go by the symptoms also. So these people are just totally devastated because they said that their symptoms were so mild, it wasn't anything that made them go to be tested right away. It's a little bit difficult and confusing, Maureen. It's a little bit more intense than it was even towards the end.
Yeah, because I know toward the end, some people that were vaccinated were testing positive, but then the ones I suggest to go back and get 2 more with negatives, had 2 negatives. So
Yeah, it's very,
there were
very
a lot of
difficult.
false positives back in May. And
And you have to remember also, those who test positive can test positive up for 90 days. So those people, they're asymptomatic. And I've seen a lot of people that I've been doing the tracing on is that they don't have any symptoms. So they're very good people, though. I'm telling you, that are vaccinated and are tested positive, even though they know that sometimes some of them will not do anything, and those that are even negative will not go out or do anything for 3 or 4 days, and they're ones that are showing symptoms 4 or 5 days later. It's this variant is very different.
So the good news is the disease burden seems to be, the actual disease. The bad news is that the administrative burden and the people burden, because these are all these people who now have to kind of stop what they're doing, it's still really messy and really inconvenient. And again, part of why I'm on the pro-mask, which is if you can just reduce that burden for the community, all the way to the ICU nurses who are taking care of the really hard cases and who are really burnt out. I think it's not a big ask.
It is very noticeable. We've done a little bit of our own little investigation. We've sent our clerk Denise out. Melissa's gone out. I've gone out. We've gone into different establishments in both communities, and we are totally amazed at the amount of people who are wearing masks. It has increased definitely, and these are people doing it on their own, which is kind of nice. Today, Melissa and I went to get lunch, and lo and behold, we had to fish through Melissa's pocketbook because we didn't have masks. But this store, this vendor did require that you had a mask. So Melissa and I were kind of happy. We put a mask on, the 2 of us, and we went in. It was a delicious lunch too. Mr. Lyons, I see you. Did you want to speak?
Yeah, I think I just had a question for the group. we're looking at all of our mitigation strategies. We know vaccinations are one of the best, most effective strategies in kind of knocking the virus down. When we look at our 12 to 19-year-old vaccination numbers, in a lot of ways we're proud of them, but we also see that we still have just shy of 1,000 students in that age group that still need to be vaccinated. We're also looking at the guidance at pre-K through really through middle school. And we are, the majority of those students are not vaccinated, right? And so all of our pre-K through 6, the majority of our 6, we have a few 12-year-olds and 6, but the majority of grade 6, those students are not vaccinated. So we're looking at all of our mitigation strategies, including masking. And I'll be honest with you, I don't know that we have a lot of time to communicate to the community, our school community, because parents want to know how are kids coming back, what practices are going to be in place. So I was hoping that we would get some guidance, something a little more concrete, and just trying to kind of reconcile the differences, right? Because we have the CDC saying everybody should be masked. We have the American Association of Pediatrics saying everyone should be masked. And then we have the state saying students age 2 to 12 should be masked indoors. And so, we're trying to put together guidance and a policy to follow that, that we feel like is the best way to proceed. And so I'll be honest with you, I don't know that we feel like we have weeks to wait and just to see how it goes. So I'm wondering if your board has guidance for us.
Has DC come out with any guidelines or any word?
They have, Frank. Their guidance is they strongly recommend students age 2 to 12 be masked indoors.
Age 2 to 12.
Yeah.
Does that also include teaching staff? Am I not correct?
Yeah.
So what they're advising, Elaine, is people that are not in fact vaccinated, right? And so, in fact, let me clarify that. They're saying that all personnel indoors should be masked is the guidance, right? And so, and Frank, just to speak to the guidance, the problem is that it's the CDC is a little different than the AAP, which is a little different than the Department of Ed, and they've kind of pushed it back to all kind of local communities, right? And local communities, I think, are looking to their boards of health first, and then their local committees second. And so we're just trying to reconcile and take not only our data, but all of our mitigation strategies that we know. And like I think Laurel said earlier, I think from the school side, our goal is to keep teaching and learning happening, right? To open schools, schools open as long as we possibly can. And I know that we're not alarmists, but we do need, looking at the data across the world and across the country, I feel like we need to kind of take a cautious position on this. But again, I in regard to public health, I feel like your expertise in this area is really important for us to hear.
But the Board of Health can't mandate the schools.
Correct. Right. But they can advise, Maureen, right?
Okay. Yes.
Yeah, we can advise and recommend what you could implement. That's what we can recommend. I have been talking to a couple of other school systems. It seems like most of them are going to go K through 12 with mask and all their staff to start the school year, which will probably be, I don't know, from what I've seen, probably the numbers and the science that I've seen and I've heard is probably what is probably a good way to go. It's safe. And it's like we say, maybe the vaccine has, the FDA has got 48 hours now. They may approve booster shots for immunocompromised people.
Mm.
That's another thing. And maybe we will be lucky and they will approve the vaccine for the younger children. But even if they do, implementing 2 sets of those vaccines for them is not going to put anything on a full vaccination until November, till at least Thanksgiving. And that's your cold months. That's your cold months, as we said. Now, oh, Tom, I'm sorry, Mr. Walt.
Hi, yes, I think that probably the most important thing we have right now, as opposed to the public buildings and public employees, would be our schools. I think that if we put out whether the Board of Health can do mandates or their recommendations, I think both our school systems will be back before a month is gone. So I think that is our priority right now, because think about, we were talking about how we're going to do these buildings, and then we're talking about things that have occurred. We're going to put our children back in clusters, okay? Majority of them are not vaccinated. Why would we do that without having everyone masked? I mean, it doesn't make any sense. If the governor or Desi doesn't want to mandate it, then it has to. It's left to the superintendents and to the Board of Health to back them on that. And I think that's the most pressing thing we have tonight, or if it's next week, that the board should recommend that that's what the superintendents do, that they get the children masked, the K through 12s. Look at it, the last thing we want to hear about is remote learning. So if we can get everybody on board, hey, let's get masked up. We're going to protect them. We're going to put our children back. They're still going to probably have to have 3 feet of distance with the masks on. But don't forget, there's a lot of work that the schools have to do in the next couple of weeks, because if we get back to this thing, I'm sure some of the schools have already changed. They're going to have the logistics of it. And then don't forget lunches. I mean, the kids are going to take their mask off to eat. So they're probably going to have 3 or 4 lunch periods instead of 1 or 2, because they're probably going to do 6 feet of distancing, because everyone's going to have their mask off. But our most important thing right now, and no disrespect, or no offense to anyone here, is the school systems, because they're going back in, and majority of these kids are not vaccinated. So I think that's the biggest problem we have right now, is to make sure we're all on the same page, and we back the superintendents, to do that. And I've spoken with the superintendent from my community, and I back them 100%. All we're trying to do is protect our children. That's our number one priority right now, the safety of our kids.
And my comments in the beginning were about the other town buildings. I agree 100%. Everyone should be K to 12. Because how do you know?
Yeah, well said, Tom. I don't know. I mean, so policy-wise, we can make a recommendation without, I guess we can vote. I'm happy to craft a motion. Also, we are certainly, I see members of the school committee and town council on, we're certainly able to have conversations individually with people if there's any need for that, or if there's any benefit in doing that. But I would highly endorse a recommendation that it be K through 12. 1,000 kids, not, there's 2 things. One is from kind of a psychosocial basis. I don't want people being singled out without a mask or with a mask, and I don't want to get into mask shaming. This is how we manage things when, when schools go to uniforms. It's like, enough already. We're trying to pull all the distractions out so that kids can learn. Everybody has a mask, end of story. We're not going to take time to trip over each other. That's part of universal precautions. And I think absolutely, my point about the municipal buildings is that it's almost kind of, it's good science. It is maybe exceedingly careful, but it's also kind of solidarity with the kids. I mean, I feel kind of badly for all these kids and little families that are hovered with their masks, not knowing what these tall people are breathing on them, out there in vacation land and stuff. So I would propose that the Board of Health in Wakefield highly recommends that a mask mandate goes into the school system, kids K through 12.
I would support that proposal also. I do think having it K through 12 makes sense to not single people out. I like just having one rule for everybody. And I think Tom made a good point about this being a priority. The schools need guidance. I think perhaps maybe I should also disclose that I am a parent who will be sending her children to school in September. So of course this matters to me too, but people I think really are anxious to get their kids back learning in person. And if wearing a piece of fabric over their face can make that happen, I think that that's the right thing for us to do. We need to keep them safe and we need to be clear and simple in our guidance. And I think masking K through 12 and including the staff in the building also makes sense.
I agree that, and I think someone said it earlier, it's better to overshoot to start with. And then, if there's any reason to, reduce that later on, isn't that great? But it would be harder to go the opposite way, start without and then enforce it later.
Yeah, again, the scenario I was painted was very much one of either do masks in school or go back to remote learning. And given the choice, we definitely know which one we want to go with. And unfortunately, the next few weeks are going to be very telling which way things go. That doesn't help you guys in the school system because you have to be ready to go in a couple of weeks. So unfortunately, the timing is not great, but I think, better to prepare for the worst and hope for the best.
Yeah.
I agree. I think I would go along with mandating, suggesting that if the school department wants to go with masks full-time, I think it, as a Board of Health or a public health recommendation, that's the way to go. I think it's easier to back down than it is to, like Carol Ann said, than to move up. And if we can maybe by the middle of the winter say, guess what, we don't need them as much as we did. Hopefully maybe by that time they'll have a vaccine out for the younger kids. I personally kind of doubt it, but I think it's the way to go. And I'd be happy to make that kind of a recommendation if they were looking for something from the board.
So we can only make what, a recommendation to, is it the school committee that has to say, what the final?
You can make the suggestion to the school department. They can take it, your superintendents can take it to the school committee. Of course, Desi can turn around and make something sometimes a little bit different or more confusing. My only concern is Superintendent Lyons is the pre-K program.
Yep.
What are the ages in the pre-K program? My grandchildren are out of that now.
Yeah, they're 2 years, 9 months is when kids are in. They say the cutoff is really 3. And so, but that's why the guidance starts at 2 from the state. And so pre-K, we would look, whatever we do for our younger children, we would do for pre-K as well.
Right. I mean, we can clarify and say pre-K to 12. That covers it all.
Yeah, I was going to say ages to senior year.
Elaine, I think Ryan B has a hand up, like to be acknowledged.
Oh, okay. I don't see it. Ryan,
can you unmute?
can you state your name? And
Yes, thank you. My name is Ryan Bagwell. I live in Melrose. I just saw an alert about this meeting had been occurring. I had checked over the weekend, for any Board of Health meetings, and there were none listed. I guess this was advertised on Monday. So I'm a little frustrated at the lack of notice about such an important topic. I do have 2 kids in school. One will be entering 1st grade. The other one will be entering preschool. I'm a little frustrated with the conversation here. I'm not an anti-masker per se, but count me among those who don't believe that masks and the importance placed on them has been a particularly effective tool to stop the spread or slow the spread, or to certainly end the pandemic. And I'm a little frustrated at the sort of blind faith that we are still having in mask wearing, particularly with, most kids over 12 at this point being vaccinated. I'm hearing a lot of talk about two choices: mask in schools or remote learning. And I don't really understand that concept. I don't know why anybody would think that masks in schools, that those are the only two choices, right? Look, the vaccines work. So I don't understand why there's so much enthusiasm for masking people who are vaccinated. I also don't understand why there's no talk about an exit ramp. If you guys want to mandate masks in schools or recommend them, that's fine. Go ahead. But you can't do this forever. There has to be a threshold at which we take them off at some point in our lives. And so,
That's true.
you can't recommend masks here without doing that. You can use the CDC's threshold, which is I think 50 cases per week per 100,000 people. There are several other metrics out there that people have thrown around, but I'm not hearing any discussion about that. So the idea that that here we are, cases are low, let's wear masks now, it's backwards to me. So anyway, thank you very much. I appreciate your time. I'm very frustrated by this issue, and I hope you guys will reconsider your recommendations. Thanks.
Thank you. Thank you, Mr. Bagwell. Just to let you know that this meeting was called on an emergency basis and was posted as we are required to 48 hours before. The reason why we did this was both boards were scheduled to meet next week at their regular meetings, and we felt with this increase in cases that we wish to bring it to the attention of the boards and to have conversations with them, and also to see on the school departments what was going on. I realize your frustration. The caseloads, the cases did go down after masks were mandated. There has been proof. This new variant, the Delta variant, is definitely a respiratory virus, a respiratory variant, meaning that it stays and lingers in the air. I don't know if you're quite familiar with measles, mumps, and chickenpox, which also are airborne, especially measles and mumps. About 6 years ago, there was someone who went through the gates at Disney World in Florida who was contagious, sneezed. Those particles can stay in the air for at least 2 hours. Well, no one knew about this, and people went through that gate, and as a result, that was taken back to 12 different states in which there was a sudden increase in the measles and mumps in these states, and that's what they had traced it back to. I think what the boards are trying to do is to limit the spread where we see it being spread, and especially to what we almost I consider a very vulnerable population is the young children. Yes, we have, us older, have an opportunity to get a vaccine. Unfortunately, it is not working against this Delta vaccine for everyone. Is there anybody from the board, both boards, that anybody has anything else to say? I think that what they're doing is doing the recommendation to err on the side of caution and to give the schools a chance to give the best protection and provide the most safest environment for those students to come back to school.
And I appreciate that, but look, an airborne virus there's no talk about ventilation. Ventilation is the most important thing here. Putting a piece of fabric over your face where your breath leaks out of is not doing it. And you say that cases went down. We have been wearing masks in this state dutifully for a very long time, and the cases did not go down last winter. They skyrocketed despite that. So you said that the very vulnerable population, the youngest children are the least vulnerable population to COVID. We have known that from the very beginning.
Okay, pardon me.
Everything I'm hearing is backwards. And so again, fine. I don't want to debate this with you guys anymore.
Right.
Please.
Okay.
So point
Please.
of order, we should not be in a debating point right now. So thank you for public comments, and we're going to.
I'll just close with this. Recommend masks, fine, but please specify a time when we can stop wearing them. Figure that out. You cannot mandate masks, recommend masks without a recommendation about when they are no longer needed.
We will take all comments from the public under advisement going forward. Thank you very much.
Thank you. Thank you.
Thank you.
Mr. Mayor.
Okay,
We should have gone through the opening public comment, closing.
right. Yeah,
comment
yeah.
process.
Sorry about that.
We're missing that.
So again,
Is it, yeah,
the
go
Swiss
ahead.
cheese model. But just, a point about, this is the maddening aspect of a pandemic. We're flying the plane as we're building it. So we all acknowledge that in science. And so as we gain data, the general consensus is that you proceed with caution, and you can always, and so this is interesting. This is my prediction, right? So we called this meeting the other day as we were seeing these numbers come in. Municipalities have already gotten together to do this. This is what we see in public health: is municipalities make a decision about something, and then as we see trends, and fabulously well equipped to see exactly what's going on in our community, and then it builds to a point where there's a consensus. So we may be ahead of the curve, we may be more conservative. In my mind, in public safety, I'm great with being conservative. Again, on the camp model, the state of New Hampshire had all these rules in place, and then in March they're like, oh, they're no longer a rule, they're a suggestion. And we're like, well, you know what? We're gonna keep the rule. Like, we're gonna keep the guideline. We're set up. That's what we're gonna do. We had one positive case get into camp despite, testing. And because we followed a cohort model, only a few kids in that cohort, because you can't wear a mask when you're sleeping overnight, were impacted, and the rest of the camp could go on. That's all we've got right now. So I'll drop the passion for a little while and just proceed to support the school committee, and highly recommend. And I would love to say that we have an end date. I think, Candace, you may know, but if we were to take any other disease that we know is communicable, such as measles, which might be a good model, and I think it's kind of good to look at what we know, we get to a point where we have to have an X amount of vaccination rate. That may be it. We're not prepared to say that because that's not yet a resource for us.
Yeah, I agree. I do hear the argument that it may be a little tricky to ask the older students to mask when they have been vaccinated. I can understand families' frustration about that, but I do think, I'm not a school administrator, but I imagine that it may be challenging to have one rule for a certain amount of students and one rule for another group of students, especially when they're potentially crossing paths with each other during the day. And I do think schools are a bit like workplaces. There's this prolonged exposure. they're in one area, one room for a whole day, and that's unique, you know. And I think that definitely, you know, the viral load in this Delta variant is much higher, and I think the potential for spread is possibly higher. And you know, as much as it might sting to have to ask the older students to mask, I think it may be reasonable to kind of have them set the example for the younger students, and you know, just have it be across the board, have every member of the school be doing that.
Thank you, Candace. Is there
What-
anyone else?
I have a question. What does this do for the teachers? If all of the students pre through 12 are going to mask because the Delta virus is so contagious, even with vaccinated people, what about the teaching staff and the school staff? Shouldn't we recommend that everybody be masked regardless of vaccination status?
Yeah, I thought we had kind of said that.
Oh, all right. I thought it was just, we
Yeah.
were talking age group,
On-
you know, the students. I thought we were talking grades.
Yeah, and for older
Well-
kids, I think they're gonna have to see that, you know, adults are being masked indoors now
Right.
too. You know,
Mhm.
sorry, but
I agree.
it's a different
And it's-
world. Believe me, I hate masks as much as anybody,
I know.
but I also hate that we're still in this position where, you know, we were gaining ground and now we're losing. So,
Okay.
so are there motions to be made or,
I would make a motion if that's what we're gonna do. I'd be happy to make a motion that it's as a suggestion that the Board of Health advises that we should have all public school or school age staff and children from pre-K to grade 12 masked,
right, H2,
age 2.
from two on, or pre-K, I guess,
Mhm.
to grade 12.
I just want to say one thing that
Sorry.
you know, we
sorry,
could go
sorry.
to,
We
we
have
could go
to-
to Brent-
Public
we
I'm
could
comment.
go to
sorry,
Brent-
I'm sorry, we have to
One last
stop our public participation. Sorry, Mr. Bagwell. Thank you.
Put them on. Thank you. Good job.
So recommendation from the Board of Health to the school committee that school-age children pre-K to grade 12, as well as school staff, wear masks indoors as per CDC guidelines.
Sounds good. I'll make the motion.
I'll second it.
All in favor? Frank? I am.
Aye.
Same
Yeah.
here. I was muted, sorry.
Do your roll call for that, please.
Branchero votes yay, yes.
Lisitra, yes.
Garapay, yes.
Laurel, do you want to make a similar motion?
Sure. So the Board of Health of Wakefield would like the recommendation that children school age pre-K to graduation and staff inside public school buildings maintain mask wearing per CDC guidelines.
I'll second that motion.
Can I make a suggestion, Madam Chair?
Yeah.
You might want to add visitors too, just to be
Yes,
clear.
of course, yes.
Thank you. Yeah, thank you, Administrator Mayor. That's a great idea.
Anybody inside a public school.
Yeah.
How about that? Let's get as universal as we can get.
Did we include that in ours, that it's indoors and it should be all people indoors, basically?
Right, basically consistent with CDC guidelines.
Yeah.
So the policy will be written by the school committee, but you have our backing.
And,
Sorry, Candace, I vote for that. I
So yeah, I'm gonna
It's
second
super
Okay.
hungry, two-member board.
All in favor? Linehan, aye.
Gorville, I.
Elaine, are we good?
So moved. I thank you. And Mr. Lyons, if you would take that back to your superintendent's meeting, I would like that. I also will pass on to the superintendent of Melrose that what the board has recommended. Is there boards, is there anything else you have? Any other questions or concerns in regards to COVID that you have?
So what is the story with the masks? What is the mayor, what did he propose, that it's
He
mandatory? The
He is,
suggestion?
yeah, he is initiating, implementing, I'm sorry, that mask will be worn in all municipal buildings. So that would mean employees in the building and also those entering any municipal buildings.
Oh, we're not talking, that's only municipal buildings.
Yes,
Not
that's
in-
correct.
Fine.
No, nothing else. No, outside, no gatherings. There's nothing, nothing like that. Nothing like the other, there's some cities and towns that have already put in for restaurants indoors and things like that in large gatherings. But no, he's implementing it just in all municipal buildings.
Okay.
Superintendent Lyons, is that kind of what you were looking for from us this evening?
I can bring that back to the school committee, and we have a current policy that we would work just to update as part, masking is part of a few mitigation strategies that we're working with right now, including vaccination and testing and a number of others, same as Melrose. So thank you for the support and the guidance.
Thank you. Good luck.
You're
Thank you.
welcome. Thank you.
Thank you.
Are you guys meeting next week?
At this,
So,
let me see.
Sure.
I have nothing else to do. One Tuesday, one Wednesday. What can I tell you? At this moment, I don't think that we will need a meeting. I'll try to decide in the next day or so. We want to take a look again at numbers, look at the cases again, and see if we see anything, if we see other trend, or if we never know if DPH or DESE or the governor decides to do something over the weekend. So we want to take that, but I hope to have a decision at least by Friday. If I do, definitely think we'll have the meetings. We do have the time blocked anyway. And also there still will be the COVID meeting for Wakefield, right? Your Wakefield team will be meeting again this week.
We'll be meeting every Friday, and then we will going August 20th. I think we're scheduled to go back, having a public meetings.
Right. Okay. Anything else? You can close out your meetings if you want to go, Maureen, to start with Melrose.
So,
Go ahead.
just to clarify, we're not meeting next week, Melrose, right?
Not right now, Frank. Don't.
We'll have another meeting if we need to, depending on what happens in the next few weeks.
Yeah,
right?
I really think we probably should wait a week. Let's see what happens. There's all these masking going on around us. There's all this testing. Testing is really ramped up. The vaccination ban, I want to say it's going to be back in another week or so here in Melrose. So let's see if we can get some more numbers. And let's see what happens if we see that FDA approval for a booster shot. And let's see if the FDA will kind of make up their mind on our younger children in regards to vaccine, if their data is there and if they're going to approve it. Things are moving very differently. We're very fortunate here in Massachusetts. We do have a high rate of vaccines. So we'll see what happens. Okay. I thank you all. I appreciate it. Coming.
Oh.
So
Before we leave, I know this isn't on the same venue, but are we doing flu vaccinations at the Victorian Fair? Or
yes, they are. Yes, that'll be coming out soon. We have not received even our notice that flu has been shipped yet. Melissa will be doing it. They just are verifying the dates, but I am correct, right? Melissa, we are doing definitely the Victorian Fair.
Yes, September 12th is the date that is on the calendar.
That's if the vaccine comes in, you mean?
Yes.
Okay,
And then there are other clinics set up, people, municipal employees, and also senior, we'll do something at the senior fair, and a few other dates. And we have also dates in Wakefield coming. There's probably about 8 or 10 different vaccination events.
okay, thank you.
Thank you. Okay, you want to close your meetings?
I move that we close adjourn the Melrose Board of Health meeting at 8:12 PM.
I second.
Lisetta,
Laura?
yes.
Oh, you want to make a motion?
Yes, I was just waiting for,
Oh, Bonjero votes yes.
Garapay, yes.
Lisetta, yes.
I move that Board of Health Wakefield close the meeting on August 11th at 8:12 PM. Corville, yes.
Linehan, yes.
All right.